So if you can just click the cross to kind of give consent at the top, that would be great. Thank you. I've put everybody's microphones off during the presentations, but then when we come to the Q&A sessions, obviously please remember to unmute yourself. So that's the microphone that's top right on your screens. Just take the mute off. And that comes through. I think we've had about 50 register. I can see there's only 22 in at the moment, so we might have a few joining us late. To everybody who doesn't know me, I'm Anna Pryder. I'm Head of Rural Health and Care Wales, and we're a collaboration that we work for the 3 health boards across Mid Wales. So that's Powys Teaching Health Board, Betsy Cadwaladr University Health Board, and Hywel Dda. And our work primarily revolves around looking at health inequalities that may exist for rural people living in rural areas, and then also piloting new ways of delivering health and care services that would be of benefit. We also do a lot on the recruitment and retention of a health and care workforce to rural areas, and we do a lot of information dissemination, be that in our annual conference. I don't know if most of you have been. It's held in November every year. And then in events such as these, the webinar, and we attend shows, career events, and various other events across the whole of Wales, and in fact overseas as well. I know I've done a workshop in Canada online, unfortunately, and we've been taking part in events in Belfast and France last year as well. So quite an international reach. But today we're going to be presenting 2 topics to you that we've been working on in various guises. The first one, Michelle is going to talk about walking in nature, and this was an initiative that we started back in when COVID was first happened in 2019, 2020 we started. And then the second one is an issue that does impact rural populations in particular, which is social isolation and loneliness. And we've got Dr. Deborah Morgan coming to talk to us about that later. So first of all, just a few housekeeping bits. I've talked about the microphone being off during the presentations, and then when we have questions and answers, please unmute your mic if you want to ask, or we have got a chat box as well. So feel free to use the chat box to place any questions you want there if you don't particularly want to speak. And then when it comes to the Q&A, if you can raise your hands and I'll guide the presenter to you to respond to the query you've got. And the other thing I ask is if you can all make sure your phones are on silent if you are speaking, so we don't get that. And then the third thing I want to note is that we use Mentimeter during our presentations just to gather some feedback on the topic and the presentations that you presented with. So it's up to you how you access Mentimeter. I don't know if anybody's done it before, but I'll put the address in the chat box. But if you are on your computer and you've got a smartphone, you might want to log on with your smartphone. If you're on your computer, you can just open another screen. So I've put Menit there, it's Menti, sorry, ignore that one. So the web address is menti.com. And then when you go in, they will ask you for a number, and this is the number that we're using today. It's 3286 5469. And then you register on that, and then when I do after the end of the presentation, I'll ask you to just give some feedback on how you rate it. So just to get you prepared. And then the other thing to mention is everything this morning is being presented in English, but if you want to ask any questions in Welsh, then please feel free to do so, and I can translate for the other delegates. Okay. Michelle, I know we're a bit early, but are you ready to start your presentation? If you want to come off and mute. So Michelle works as Research and Development Officer for us here at Rural Health and Care Wales, and has been for a few years now. And one of the projects that she took up when she started was to look at the wellbeing walks that we'd started in Aberystwyth. We've since expanded to Machynlleth, and we're now looking to do across the whole of Mid Wales as an initiative that's trying to encourage people to walk in nature, not just for health benefits, but also for wellbeing. So Michelle, do you want to share your screen and take over?
Okay, can you see the screen?
Yeah, and I can hear you. Everybody okay?
Okay. So yeah, I'm Michelle. I joined Rural Health and Care Wales in November 2022 and almost immediately began working on the Wellbeing Walks initiative, taking forward the work started during 2021. The presentation today will look at the work undertaken 2020 to 2025 on the development and furtherance of the Wellbeing Walk series, covering the initial development, collaboration with external partners, design and funding of leaflets to support the walks, and the launch events in Aberystwyth and Machynlleth that Anna has already mentioned, before outlining the work in progress for similar walks across Gwynedd and further into Powys. The initiative began with a request from the Greener Aberystwyth group during lockdown to instigate an initiative aimed at promoting, protecting, and raising awareness of the importance of green spaces and outdoor activities within urban landscapes on health, nature, the environment, and well-being. Following a series of discussions with various stakeholders, including Ceredigion County Council and other providers of walking initiatives in the region who supported the project, such as the West Wales Walking for Wellbeing project and Ceredigion County Council's Coast and Countryside Walking Routes team, momentum for the initiative built from July 2021. This is the point at which Rural Health and Care Wales was asked to take the lead on the project, and today's presentation is the culmination of what is now a 4-year investment by Rural Health and Care Wales and partners. The initiative responds to many of the national strategic aims of the Welsh Government, National Health Services Wales and Public Health Wales, and their regional and Mid-Wales specific priorities, as well as meeting Greener Aberystwyth Group's initial aim of promoting and protecting green spaces within Aberystwyth Town Centre. The initiative also meets Design Principle 1 of the Wellbeing of Future Generations Wales Act 2015 and meets the growing trend for social prescribing. And being based at health locations, it is hoped that they become an embedded non-medical intervention supporting social prescribing link workers and the advances of more community-based prevention support. The Wellbeing Walks also support community engagement for people living with a number of conditions, including cognitive impairment. They also have the potential to support mobility and bone health, as well as offering the potential for brief spells of respite for hospital visitors, carers and health professionals, as they are based close to hospital entrance and exit points and surgery entrances. The overall aim of the walks is to encourage people to walk and spend time in nature, something that is increasingly recognised as a means to improve physical and mental health and well-being. Linking walking with traditional sites such as GP surgeries and hospitals will hopefully strengthen the association between the two. Furthermore, health professionals are keen to integrate social or green prescriptions as important health and wellbeing interventions that everyone can embrace. And this is the start of the information which is provided on the leaflets that we subsequently produced. As part of this work, RHCW has also undertaken both a national and international research review of the benefits of walking in nature on all aspects of health and well-being, and on the importance of green spaces within accessible reach, on community self-esteem and self-reported health status. Findings from this review are being drawn up as part of the Wellbeing Walks Initiative report, which we hope to have in draft format by the end of March. The key message is being, physical and mental health benefits of spending time in nature, and the wellbeing benefits of spending time in nature. A substantial literature review was undertaken as part of the work, with a total of 1,844 references being returned from searches undertaken in the Medline, MBAS and PsycInfo databases. This was filtered to 37 papers for further analysis and review. The key themes identified being the link between exercise and physical health, population-wide low levels of physical activity, nature's impact on mental health, the environmental, physical and mental impacts of walking for health, and the barriers and challenges to walking for health. Comparisons between rural and urban environmental barriers to walking. The research evidence that walking has a positive impact on specific mental health benefits, such as those shown on the slide, reduction in stress and anxiety levels, improving concentration, increasing creativity, treatment for depression, and improving sleep patterns. There is also a proven link between walking and specific physical health benefits, including protection against heart disease, cardiovascular disease, stroke and hypertension, prevention of falls, keeping muscles and bones healthy, assisting with the long-term care of conditions such as arthritis, building stamina, improving energy levels and weight management, assisting in long-term care of respiratory conditions including asthma and COPD, reducing the risk of dementia and improving memory, decreasing the risk of type 2 diabetes and some cancers, and easing of menopause symptoms. Undertaking any activity, including walking for social health at any age, is seen as important for a range of health and wellbeing benefits, and it also encourages and fosters trust and confidence amongst communities, which helps to combat loneliness and isolation. Leyden 2003 stated, spontaneous bumping into neighbours, briefly, seemingly trivial conversations, or just waving hello can encourage a sense of trust and a sense of connection between people and the places they live. Regal in 2021 also stated that there were 5 additional ways to walk with purpose. For perspective, reflecting on nature and the universe. Which links with the aims of the Rural Health and Care Wales Wellbeing Walk series, specifically connection, because you don't have to walk alone. You can walk with friends, you can walk with groups, you can just walk with your dog. For learning, whilst listening to a podcast or audiobook. For gratitude, focusing on the positives of being able to walk. And for productivity, walking and talking meetings. Rural Health and Care Wales also undertook a walk and talk meeting as part of their promotion of National Walking Month in May 2023. Walking is also considered an accessible activity across all protected characteristics of the Equality Act 2010, enabling a widespread participation. However, subtle elements of low-level support for people living with disabilities have been identified. Christie in 2018 found that regular walking is achievable for most people without a disability, whilst Guinness et al. In 2021 found that compared with the general population, far less high-quality research has been done on the health benefits of physical activity for people living with disabilities. The physical activity epidemiological evidence based on people living with disability tends to be siloed within medicalised conditions, and most disability-related research has focused on improving function rather than health. As part of the literature review, we identified a series of gaps in the research, and these can be categorised in three groups: rurality, specifically Welsh rurality, health improvements and resilience, and accessibility. Specific categories within these 3 bands are shown. I'm not going to read them, but you'll get copies of the slides, so you'll be able to see them for yourself. The official launch of the Aberystwyth Wellbeing Walks was conducted by the Mayor of Aberystwyth on the 8th of December 2021 at Aberystwyth University's Healthcare Education Centre, located alongside Paddon Surgery, with a subsequent press release appearing on the 6th of January 2022 in the Cambrian News. Significant public engagement followed followed the launch of the Aberystwyth Wellbeing launch, with press coverage and social media. There's a slide of the launch in Aberystwyth. The Wellbeing Walks Machynlleth leaflet was then developed by Rural Health and Care Wales and partners, including Coed Clayle, and was launched at the Brotherly Community Hospital in Machynlleth on the 27th of October 2023 by the town's mayor, Councillor Jeremy Page. This is a picture here, is the leaflet that we produced for the Machynlleth Walk, and there is the image of the launch event. Routes from the proposed GP health and hospital starting points were explored, and initially Greener Aberystwyth Group supported the design and mapping of the Aberystwyth Walks. Funding was sought and £2,000 was received towards leaflet design and production from the Ceredigion Association of Voluntary Organisations in September 2021. A second print run of leaflets for Aberystwyth was undertaken by Rural Health and Care Wales in 2024. For the design and mapping of the Machynlleth Walk, Rural Health and Care Wales was partnered by Coed Clayle. Coed Clayle have also undertaken to fund the second print run of Machynlleth leaflets, and there is scope for possible collaboration with Coed Clayle on other walks in the series which fall within the Dovey biosphere. The Wellbeing Walk leaflets were produced in conjunction with the local designers and printers and have distinctive styling aimed at being eye-catching and familiar. The walks are self-guided but can be used by walk leaders or walking groups, especially for longer walks. And Rural Health and Care Wales has suggested a discussion with a GP before commencing any of the walks to ensure suitability. The walks are aimed at empowering people to fortify their own health. And this is all of our walk leaflets that have been produced so far. As well as the information on the natural environment and historical information included on the leaflets, each of the walk leaflets has a set layout to include colour-coded map routes, indicators of distance, surface, time and ability, and a key for highlighted features on the map, including hospital sites, seating and toilets. To date, 3,000 of each of the Aberystwyth leaflets have been printed, 90% of which have been distributed across 9 physical locations in Aberystwyth, including Bronglais Hospital outpatients, Church, Paddon and Ystwyth surgeries, and the town library. The full list is here of each of the locations that we have distributed. We've also done e-distributions to a number of partners, and the most recent request for the Aberystwyth leaflets came in January 2025, where 15 of each of the leaflets was requested to support Careers Wales in their careers events at schools. The most popular walks in Aberystwyth have been those from Paddon and Church surgeries. Ystwyth leaflet distribution and take-up rates have been very low, as the surgery opted to maintain COVID restrictions on reducing or removing hard copy leaflets from its waiting room. They did, however, take around 5 to upload to their electronic display board and for staff use. For the Machynlleth Wellbeing Walks, 736 leaflets have been produced, of which 712 have been distributed across 12 physical locations in Machynlleth, including Brotherly Community Hospital, GP surgery, 2 dental surgeries, Town Library, a PLAS, CAMAD and the Powys Advice Centre. A second print run was undertaken by Coed Clayle in 2024. We don't have data on their numbers as yet, but it's hoped that we'll be able to do the same sort of curation in terms of distribution stats as we have for Aberystwyth. Work on the series in Gwynedd started at the end of 2024. Work to date has focused around engaging with potential partners to assist with the development of the walks and seeking funding opportunities. Initial work in Gwynedd is focused on Dolgellau, Tywyn and Barmouth. Similar activity is being undertaken in Powys to extend the Powys series, which commenced in Machynlleth. Initial contacts have been positive and focused around Newtown, Llanidloes and Llandrindod-Wells. As you can see from the slide, Rural Health and Care Wales has covered a lot of ground in disseminating the health messaging and promoting the fit with the Welsh Government preventative agenda and the health messaging contained in the Wellbeing walk leaflets and in the furtherance of the fundamental aims of the initiative to highlight the health and wellbeing benefits of walking in nature, providing an accessible activity for healthcare professionals, patients and visitors, and enabling groups of people to engage with wellbeing and walking in nature activities to promote the appreciation of nature. Further analysis of the impact of the initiative forms part of the ongoing work, including analysing collated leaflet take-up data, social media promotion responses and engagement with other agencies with an interest in wellbeing and the green agenda. Assessing the impact of the initiative on participants through direct engagement with users via online and manual surveys. Specific feedback is being sought on the impact of encouraging people to walk more outdoors and the increasing recognition of the health and wellbeing impact of spending time in nature. Work has also been undertaken to assess the effectiveness of the leaflets produced. This active research element of the work is ongoing with a call out for volunteers to walk the routes and feedback to us on their experiences. To date, response to this call has been very poor, and renewed effort will need to be considered following the launch events of any walks finalised this year. Comments received to date, however, include very informative leaflet. We will have as many of the leaflets as you can give us. We keep running out. Nice layout, useful for discussion with clients. And for balance, highlighting car parks, not helpful, as we should not be advising people to park at sites to go walking, especially at the hospital. So that's the end of the presentation, and this screen is the contact details for myself and for the rest of the team via our social media sites. Thank you.
Thanks, Michelle. Are there any questions that anybody would like to ask? Either raise your hand or drop a line in the chat box. I suppose there is one, but I think it's Mark, is it? Yeah, Mark, do you want to ask Michelle a question?
Yeah, thank you. Great, Michelle, that's really good. It's just more of an observation, to be honest. As I was involved, well, I was pictured on the launch for the Machynlleth one, and the feedback, albeit anecdotal, it's been a great success. We've had the walk leader training in the boardroom that Coed Clayle started, and they do walks every Friday. And the evidence is that the cafe is a lot busy on a Friday when the walking groups are there having their coffee or having a bit of lunch. So it's been a great success, and I've reported that back to Welsh Government as part of the integrated hub development and discussions. And of course, further research with the social prescribing framework, and the task and finish groups, and how we can develop nature-based solutions, walking groups, and sort of nature-based solutions we can sort of do in the future. So no, it's fantastic, and yeah, I'll be happy to help with any discussions in Llandrindod, Llanidloes, or anywhere else in Powys. No problem. Thank you.
That's brilliant. Thank you, Mark. Right. Yeah, and
Thank you.
it's good to see that they're being actively taken up, and quite clear are brilliant partners in this, and Powys, so Powys Teaching Health Board. And I think that's when you get partners together in a room, because the idea is to really get that focus on prevention, isn't it? And that's what people will see in the next few years. There's going to be a huge drive to get people to do more to prevent ill health. I think we can't stop the aging process, can we? But we can do something to try, and walking is one of the most accessible forms of exercise that everybody can do, that will benefit them. They're not just their physical health, but their mental health as well.
Yeah,
so
we are very quickly, Coedlil, developing like an outdoor-based, we've done a feasibility study with Coedlil, and a national lottery bid has been put in. Hopefully we'll find out next month whether that's been successful for a 3-year sort of revenue funding of developing nature-based solutions. 40% of it will be at the hospital, but the outlying areas as well around sort of that area of Powys. So yeah, so we're excited about what can come out of that as well.
Yeah, that's brilliant. And if it is successful, hopefully Rosie or someone can come and present on what you're planning to do with that, because it's quite aspirational, isn't it? That's great.
Sure.
Gabrielle.
Both surgery and the activities which are linked to that surgery isn't obviously in your particular sample, but there is a working group, which is linked to both surgery, or rather linked both surgery with both Community Hub, and there is a weekly walking group organised for the kind of sample that you have been talking about. I'm sure you're aware of that, but I'm not sure whether you're collecting data from that particular group.
I have, sorry, if I can just say, Gabrielle, I have spoken to Helen, who leads that walk, and I have shared with them the leaflets to see whether or not they'd be interested in joining that, collaborating with us. And I did report that back to Anna. I think it was the middle of last year, but we haven't heard back from Helen as yet.
Okay, maybe I can drop a word on that. There are some organisational difficulties for the leaders of such groups, because you tend to get a rather disparate collection of people who have different needs, different walking paces, some that want to bring their dogs, some that don't want to bring their dogs. So I think the organisational aspects of bringing together groups of people with, as I say, disparate mental health or physical needs is actually quite demanding. It's also quite demanding walking in environments such as Borth in the winter, which is not particularly encouraging on some winter days.
Yeah. So, I mean, the premise on which we've produced the leaflets is that they are self-guided. So the arrangement of an organisation of walking groups isn't something that we would be involved in. No. But, we do encourage people, if they can use our leaflets and they already have walking groups, then they can use those leaflets to do that. But it is the aim of the leaflet is to empower people to take responsibility for their own mobility in as far as they can, by consulting a GP to see what is suitable for them to undertake themselves. But there are several places, as Mark has already said, in Machynlleth, there is a lead walk using the leaflets, but those leaflets are also available to individuals to go and do those walks on their own.
Yes, thank you. Just one quick further point. Have you made a connection with, excuse me, Ceredigion carers? The group, which is part of the wider group of Credit Cymru, which supports unpaid carers. I see there's a link with the connectors, but I wonder if there is involvement with Gofalwr Ceredigion.
Well, I've spoken to them on a different issue, but I have had quite a lot of engagement with the community connectors, and through the community connectors and the How Old Our Mental Health team, we've managed to distribute those leaflets out so that they are available to carers. But we aren't monitoring uptake in any sense.
Okay, thank you.
Thanks, Gabrielle. John, you've got your hand up.
Thanks. Yes, John Gladstone from Avon Access. Just your point about disabled people as a wheelchair user. Been working with Natural Resource Wales and national parks, etc., on the design of accessible footpaths or more accessible routes. For example, the coastal path, which joins a lot of us together. And it's been quite a struggle actually getting them to acknowledge that structure. Is that something that Michelle or Anna you'd be able to help with in any way?
Yeah, it is something. I mean, we considered accessibility, and it is a problem. I understand that. And on the leaflets, we have tried to indicate which are the easier, flatter routes without obstacles, and wherever there may be obstacles. But yeah, it is a definite issue, John. So yeah, if you want to link with us on that, we'd be really interested to see any work that you're doing with NRW. Was it you said you're working with?
Well, yeah, NRW. We're currently putting a North Wales access panel together with Bets Cadwallader.
Okay. Yeah, that'd be really interesting, particularly as we're trying to do the walks now up in Gweminar, which come under Betsy.
Yeah, so I've got a meeting tonight with Gwynedd about a walk around Llyn Padarn.
Okay.
But there's some pressure against it, shall we say, from various groups that don't support access to the outdoors.
All right.
And health and well-being, shall we say. Thank you.
That's a shame. Yeah, we'll be in contact. Thank you, John.
Okay.
Has anybody else got a question from the floor or anything in the chat? See, we've been asked for a copy of the transcript of your talk and a copy of the reference literature to the research, Michelle, which I'm sure you will provide. And of course, everybody will be sent a link to a recording of today's webinar and a copy of the presentation. We upload all our presentations to our YouTube channel, and anybody who's registered to attend will be sent a link so that you could share with anybody you feel might be interested or revisit yourself as and when. And all presentations are time stamped, so like today's two talks you'll be able to link on whichever one you're interested in. Gabrielle and John, are you able to put your hands down? Sorry, if not, don't worry, unless you've got another question. And then Rodri, I can see you've got your hand up. Do you want to ask a question on Michelle?
Yeah, hi Anna. Yeah, hi Michelle, that was really interesting. Just a couple of comments really. Really interesting and good to hear all that work has been done. Is it planned to be rolled out across other areas of Wales? Like, say, I'm in Swansea, I research at Swansea University, but in Swansea there's so many lovely places near the hospitals and GPs, but I never see anything like this when I visit them.
Yeah, I mean, our focus area is Mid Wales. Oh, okay. So can you hear me now? Can you hear me?
I can hear you. I don't know. Can everybody else?
I can't hear anything, sorry.
Right.
I'll come back to you.
Okay. Well, yeah, do you want to carry on and answer the question, Michelle? It'll be recorded.
Our focus area is Mid Wales, so we would really be looking at Ceredigion, Gwynedd and Powys.
Okay.
But that doesn't mean to say that the initiative can't be taken forward by someone else in Swansea, for example.
Yeah. Okay. Sorry, I missed part of that. My headphones went weird, but no, it's interesting. Thank you. And yeah, it just seems like a wasted opportunity. Loads of places to use this kind of thing. And the other one, very, very quickly, it's only something I found out about last week with all the talk of well-being and nature. You often think, oh well, it's obvious why it is, but I'm not sure if you've heard of the EMDR mental health therapy. It's actually I was talking to someone last week. He's a counsellor, educational psychologist, but he uses EMDR, which is, let me tell you what it is, eye movement desensitization and reprocessing. I'll put a link on, but effectively they use it for counselling with post-traumatic stress, and apparently it was created by a lady in the 70s in America called Shapiro, and she, through kind of accidents, found out a link between walking in nature and your eye movement between the trees, or between whatever in nature. I'll send you the link. It's just a kind of comment really, but I came across it last week from a personal kind of involvement. Just thought it'd be quite useful. And if people understand that kind of thing, it suddenly go, oh wow, I get why, if I'm out in the countryside or out in the nature, maybe there's that link and perhaps helps with the education aspect of it. But yeah, just a kind of comment really.
Yeah, but I mean, I think that there is a recognised health thing as well, isn't it? So even if you're just sitting at your desk, to avert your eyes to a window so that you change your view and the position of your eye, that helps with the mental balancing.
Yeah, exactly.
So I think that all fits. Yeah.
It was just interesting that kind of the link between someone's kind of made a technique out of it, and I think it's on the NHS now as well in certain areas. So it's not just a kind of quack type thing.
Yeah.
But yeah, no, it's really good. Thank you.
Thank you.
That sounds really interesting, and thanks. I can see you put the link in. I'll follow up on that. I personally hadn't heard of it, and I know Angela seems to have heard all about it as well. Anybody else got a question for Michelle? No? Okay, brilliant. Thank you so much, Michelle, for that. I shall unpin you. Can everybody now try and get onto Mentimeter? It was menti.com. You remember? Can you see this now on your screens? So the number you need, a lot of you already are there. That's excellent. So the number you need to put on is menti.com, and then the number is up here at the top. And then if you can rate it, that would be really useful. We have to evaluate all our work, and we like to evaluate, what talks you find interesting and which ones less interesting. So it's always really good to know. I'll give you a couple of minutes to get on there. Or you can access on your phone or on the computer, or an iPad or any smart screen you've got. Right. I'll let you carry on with that. The next talk then is at 11 o'clock. So I'm not sure if Debbie's here yet. Don't think so. So if everybody is fine, what we do, because we record it and because a lot of people are joining online, some people are only coming back on for the second talk, or some might have come on for the first talk only. So we won't be restarting until 11 o'clock. So you've got a break. You're welcome to go and make some coffees, have a comfort break, and come back online at 11 if that's okay. All right. Thank you. Housekeeping comments, if those who haven't been on before. We'll have the presentation by Dr. Deb Morgan, and then there'll be a question and answer afterwards. So if you have got questions whilst the presentation's going, you might want to make a note of them, or you can drop them into the chat box. And when the presentation's finished, you can raise your hand and ask the question. And we ask everybody to keep their microphones off whilst the presentation's going, and then obviously put it on when you ask a question. Keep your phones on silent. And then the other thing to point out is that we do instantaneous evaluations on all our webinars. So we're using Mentimeter for that. So I will put the link so you can get ready for it. You probably see the one for the previous presentation if you did log on now, but you might want to keep it there for reference. So it's by going on menti.com, and they will ask you for a reference number, which I've typed in the box, 32865469. When they ask for that, you can type that in, and we'll do that at the end. Okay. So if everybody's back, I think we can make a start. I can see Deborah Morgan there. So if I can introduce Debbie, who is, sorry, I call you Deborah. What do you prefer to be called?
I'm easy, to be honest.
Okay, Deb, you signed, so I'll call you Deb, who is research manager with ENRICH, and I'm sure she'll tell you a bit more about herself. And the presentation talk is going to be about loneliness, something that is critical at the moment, not just in rural areas, but across urban as well. And it's impacting everybody. Ever since the pandemic, it seems to have increased significantly. And loneliness, social isolation, as everybody knows, leads to health, physical health and mental health issues. So Deb, if you want to take it away and present your topic. Thank you.
Thank you very much. So good morning. Yeah, it's still morning. I'm really delighted to have the opportunity to talk to you this morning about a topic that's really quite close to my heart. It's something I've been researching for the last 15 years. Loneliness is something I experienced myself, and I've seen others close to me experience. Although it's a normal human emotion, it's one I think we're very reluctant to talk about because there's a shame and stigma attached to it. And we'll address some of this as we go through the presentation this morning. Often when I talk about loneliness, I ask people to think about the one word that springs to mind when they think about loneliness. And I've put some of these on the slide. Let's see. So it's a bit of a word cloud. I hope you can see that. And these are some of the most common words that people tell me that it spring to their mind when they think about loneliness. So it's people are perhaps bored, they're feeling sad, they're alone, solitary, isolated, friendless. You know, the list goes on. And I think some of these words represent common misconceptions we might hold about loneliness. The first being that lonely people have no friends or family around them, that loneliness is just an issue of older age, that lonely people just need to meet other people and then they won't be lonely anymore, that loneliness is an individual issue, and I'm going to discuss this a little bit more later on, and that there is a loneliness epidemic. I mean, it's undoubtedly there are a lot of people who are lonely in the UK and globally. Since COVID, there are about 500,000 more people who are chronically lonely than there were before the pandemic. So it is a big issue, and it affects many people of all different age groups. So before we really sort of get into some of the nitty-gritty about loneliness, one thing I do want to do is talk about what the difference is between loneliness and social isolation. And these are two terms that they often get conflated and they're used interchangeably. Loneliness is a normal human emotion, as I said, and it's one that in its transient form is very common. And it's been likened to a physical pain in that when we have a physical pain, it tells us that there's something wrong with our body. Well, loneliness is being referred to as social pain that reminds us that we need human connection. Because as humans, we are social beings. We need to be in group settings and have contact with others. And loneliness is a result of a process where, as an individual, we weigh up our existing social relationships to our family and friends, and we measure those against our own wishes and expectations with regards to those relationships. And when there's a mismatch between our expectations or our wishes, so for example, if our network is smaller than maybe we'd like, or the relationships that we have, we think there's they're insufficient in their quality. There's something lacking in those relationships. We would likely to feel lonely. So it's very subjective. And what this means is that someone with a very small number of friends may never experience loneliness because their relationships they have meet all their needs in terms of the quantity and the quality of those relationships. Conversely, somebody who has a large group of friends may become lonely because they perceive those relationships to lack in something, either in the quality or the quantity of them. Now, as I said, loneliness often gets conflated with social isolation. And while they're related, they are very different. So the Global Initiative on Loneliness and Social Connection defines social isolation as having few relationships or roles and infrequent social contact. So we say it's subjective in that we can measure it by looking at the number of people somebody has contact with over a defined period, so say over a week. And if it falls below a certain figure, we would deem them to be isolated. Well, loneliness, as I've just said, is very subjective, and what the threshold for loneliness is for one person will be very different from another. And I've seen this a lot in my research. I've had people who've been in almost identical circumstances, and the one person's been lonely and the other one hasn't. So, as I said, it is very subjective, and that threshold will differ for different people. But what this means is you can be lonely without being socially isolated. You can be socially isolated without being lonely. Or, of course, you can be both. And data from my PhD, where we done a survey with 3,500 older people in Wales, we found that 11% of older people were both lonely and isolated. So it's a substantial number. So who's lonely? Oh, I've also got some other words I've put on here, some other terms that often also get conflated with loneliness. So we've got aloneness, solitude. The difference between being alone and solitude and loneliness is we might choose to be alone, we might choose solitude, we never choose loneliness. Social exclusion is another one that often comes up in relation to loneliness and social isolation. It is different, but loneliness can be an output or an outcome of social exclusion. So, who's lonely? I think in reality, we all have the capacity to be lonely, whether that's been in our past, our present, or our future. But some groups are more at elevated risks because, like many things in life, vulnerability to loneliness is not created equal. And that's not to say these groups of people will definitely become lonely. It's just their risk is elevated. So we can see there, older people, slightly at more risk. That's because of the number of losses and experiences we might accumulate as we reach later in life. People with disabilities or chronic limiting conditions, around half of people with a disability report being often or always lonely. Young people, we've started to hear more about younger people experiencing loneliness. And recent research, Action for Children, actually found that 43% of 17 to 25-year-olds who were using their services reported being lonely. We know that informal carers and those in a caring role are also elevated risk. So a study just pre-pandemic found that 44% of informal carers in the UK reported moderate loneliness and 18% reported being severely lonely. We also have high rates of loneliness in migrants and refugees, and also in people from ethnic minority communities. And again, research has found that their prevalence rates are very high among those groups, but also they also experience social isolation, particularly among asylum seekers and refugees, which is perhaps not unsurprising given that they've moved to a different location, maybe don't speak the language. Likewise, prevalence of loneliness is high in the LGBTQ community, where around 21% of that community pre-COVID reported being often or lonely every day. Care leavers, 1 in 5 care leavers report loneliness. People who are homeless are another group that are at elevated risk. And there's also a socioeconomic gradient to loneliness. So the more deprived your living circumstances, the more likely you are to be lonely. So, as I said, it affects all age groups. My research is focused predominantly on older adults. But as I said, this is a U-shaped distribution where it's high in younger and older people. Different factors might contribute to loneliness in these different age cohorts. So, for example, for younger people, loneliness severity might be linked to developmental or transitional life changes. So, starting a new job, going to university, or moving away from home might be a trigger point for loneliness. Whereas for older adults, loneliness might be the consequence of losing a partner or family member or friends, moving into care facilities, as I've said. Having increased financial difficulties due to the sort of loss of a regular income, and our socioeconomic status might be less as we get older. So on this slide, we've got some of the risk factors associated with loneliness in later life, and you can see they're quite broad, and I've tried to group them. So we've got the socio-demographic factors. So there's some research that suggests the older you get, the more likely you are to be lonely, although this is increasingly being contested. Marital status, so people who are divorced, single or widowed are more likely to experience loneliness. As I said, financial resources. Often we use as a proxy things like housing tenure, access to a vehicle and educational level as predictors of whether somebody is going to be lonely in terms of their financial resources. Then we've got things like health factors, so disability, being a carer, the onset of illness, things like cognitive impairment. Then we've got our life events. Retirement migration is on there, which is an interesting one, because I think sometimes people think about, oh, when I retire, I'm going to move to the coast or the countryside. And actually, that can be a trigger point for loneliness. And that came up quite a bit in my research. And then we've got loneliness and social isolation as a function of location. So there are different factors for urban and rural areas, things like lack of accessible transport, lack of local facilities, and as I've touched upon, living in a deprived area. And we know, so for example, some of these risk factors, I said, although they're quite broad, they might be cumulative over the life course. We know, for example, that for women brought up in childhood households where there were financial difficulties growing up, they're more likely to be lonely as they get older. And a recent study in New Zealand that was only published this year actually found that childhood socioeconomic status had a significant effect on loneliness. And indeed, childhood circumstances explain 7% of that variance in loneliness in later life. We also know that gender, and you can see that on this under the socio-demographic factors, gender also shapes the loneliness experience. Men are less likely to report loneliness, but they're more vulnerable to it, particularly after a spousal bereavement. And that's because men tend to rely on their spouse for emotional support, and maybe keeping in contact with other family members and that sort of wider social network. While for women, a change in economic status following the loss of a partner might result in fewer opportunities for social interaction, increasing their risk of loneliness. And as I said, some of these factors will also affect vulnerability for younger groups as well. But as I said, it's more than just an individual concern. It's also influenced and shaped by sort of wider societal factors, so legislation, policy, welfare, and also at a more local level in relation to community environment, socio-cultural factors. And so to give you an example of what I mean by this, we know, as I said, that financial and material conditions are important because they shape and influence the relationships people might or might not have across the life course. So things such as fear of crime, neighbourhood safety, population density, and the use of all open spaces can inhibit or promote social interaction. And the environment itself can give off messages. So if you think of an area that's perhaps very deprived, there might be broken street lights, lots of graffiti and rubbish. It might give off the message that people there are not to be trusted. While societal norms and cultures, things like and values and things such as ageism, racism, discrimination and stereotypes about older people can all contribute to exclude people from that sort of civic and social participation that results in loneliness in later life or across the life course. And I said we've seen some of this in some of the stats I presented a bit earlier. So I think one of the things that's really important for us all to recognise is some of those trigger points for loneliness, because it's only when we understand what the trigger points might be that we can support people or support ourselves. And these triggers for loneliness are not always negative in nature. They can be normal life transitions, things such as moving, or arising from a positive event, things like having a baby. We know that's a trigger point for younger women. And all of these triggers involve some sort of change in your social identity. And the triggers, they don't necessarily lead directly to loneliness, because every individual holds a level of risk for experiencing problematic loneliness. So, for example, if you move to a new area and your work enables you to get out and meet new people and develop those social connections, you're less likely to experience loneliness. But if you move to a new area and you're a carer, for example, your situation at home might limit your ability to socialise and participate in activities outside of your paid work, therefore increasing your vulnerability. What was obvious in the work that I've done is that regardless of the triggers, older adults that I interviewed all experienced loneliness as a disruptive event. The trigger and the loneliness punctuated their life course into before and after. And it shifted their sense of who they were, their expectations about their family and friends, and it made them reevaluate their life to date. Now, some people were able to recover, and I don't think we hear enough about the recovery from loneliness. And the reason some of these older people recovered, they had other valuable identities outside those they lost. So, for example, one of the women I interviewed had been married since she was 17. So she was very, very young when she got married. When she lost her husband, she was 72. And for her, her identity as a wife and a partner was really important to her. She helped to recover from loneliness because she had other valuable identity to fall back on. She was part of a member of a religious community. And she was very proud to tell me that, this was who she was. I'm a Jehovah's Witness. This is my community. I belong. And that really helped her in her recovery from loneliness. Conversely, I also had a teacher who, on retirement, he actually moved countries. And various things happened to him and resulted in him being very lonely and isolated. But he took up various artistic endeavours. And although he became lonely, he then valued his identity as an artist, which he felt that his loneliness was conducive to producing art. So for him, that was something he could fall back on, that he found was helpful. For those transitioning out of loneliness, it was also important, as I said, that their expectations about their family and friends and the way they would respond to these changes were met. And that they had resources, be that financial, cognitive or social, to help them recover from loneliness. Where those things were lacking and people's expectations were not met, or they had no other identity to fall back on, they tended to transition into a more chronic form of loneliness. And we could see that over and over again. And people saying, that the family hadn't, or their friends hadn't been able to respond in the way they'd hoped. I had one lady who became lonely after the death of her husband. She had a visual impairment, and although she had friends that would go shopping with her, one friend in particular would forget she was visually impaired and wander off and leave her in the shop. And that just sort of amplified her feelings of loneliness. Now, we've also why is loneliness so important? Anna touched on this. There are health, negative health impacts of loneliness and social isolation. In its transient form, it's unlikely to harm our health. It's just an unpleasant feeling. When it's chronic and it's ongoing for a long period of time, it really does start to affect our physical and mental health. So we see on the slide here, it can increase your risk of dementia and cognitive decline. We see increased blood pressure, higher cholesterol. It's associated with an increased risk of developing coronary heart disease and stroke. It also increases our risk of morbidity and mortality. So increases the likelihood of mortality by around 26%. And you've probably heard that often quoted statistic is the effect of loneliness on mortality is comparable to risk factors such as obesity and has a similar influence as smoking 15 cigarettes a day. So, it can have quite a significant impact. It's also related as a risk factor for the progression of frailty. And as I said, it affects our mental health. It's greater social anxiety, depression, and it's predictive of suicide in later life. And I've just put some quotes on here just to show you that impact from a lived perspective. And you can see here that this widowed female, so she's been in a very, very dark place. She was a woman who was transitioning out of loneliness at the time. She didn't care if she didn't get up in the morning. She just wanted to live day by day and just get it over with. And you can see there's a 72-year-old male in the same position. He didn't care if he died. So it was having a real significant impact on their mental health, which then affected sort of things that how they were eating, maybe taking up unhealthy habits. One of the gentlemen I spoke to was drinking a bottle of wine every evening just to sort of numb those feelings. So it does have a really significant impact. And it also affects people's confidence and self-esteem. They start to be eroded the longer that loneliness goes on. So one of the things we come across time and time again is a real frustration of mine, is the way we talk about loneliness and social isolation. And I've given some examples of some headlines here in the media, and it's not just the media. I think narratives in general, in the general population, the way we talk about loneliness can sometimes reinforce that stigma. So you can see here, it's a threat to public health. It's a tragedy. It's, there's an epidemic. People have forgotten. And I think if you're a lonely older person or a lonely person of any age, this is not going to help you want to come out and seek help, because from my own experience with the people I've interviewed, they internalize some of these narratives, particularly among older people. I think that's just a thing. I'm older, I'm going to be lonely. There's nothing you can do for me. But things like ageism, racism, and like I said, these stereotypes around aging all feed into and prevent people from seeking help. And some of these headlines in particular, I think, are really unhelpful, saying that people are aggressive. So I think we all need to be really careful about how we talk about loneliness, and remember it is a natural human emotion. So what can we do about it? I think that's the next thing. So I think for ourselves, as I said, any one of us can become lonely at any time. I think we need to think about and prioritise our existing relationships. Too often, I don't think we think about our relationships with other people until they're gone. And I think we need to think about them now. Think about our expectations around those relationships and build trust. There have been a few studies that show that trust is really important. So there were some studies done in Glasgow in a very deprived area and found that trust was low, loneliness levels were high. So I think building trust with your neighbours is challenging, particularly if you're on social media and you see all the nonsense that's put on there to cause distrust and divide people. So I think that's one thing we need to think about for ourselves. I think we need to expand our social networks through new groups. And one thing we know from the research is the more diverse your network is, the less likely you are to be lonely. And as I said, change the way we think about our relationships. When we're thinking about how we can support others, I think one of the key things is to understand what those triggers are. And if we know that somebody is perhaps coming up to retirement, or they've experienced a bereavement, or they've had a new baby, or whatever, we can put support in place to make sure that they perhaps, even if they feel lonely, they don't fall into that chronic loneliness trajectory. We can change the way we talk about loneliness and be more open about our own experiences. And I said, I think that's really important if we're going to address that stigma. And I think we also need to think about and remember that individuals might need additional support to get back out into the social world. As I said previously, confidence gets eroded really quickly, self-esteem gets eroded really quickly. So individuals who have experienced loneliness over a longer period of time might need other forms of support before they can be introduced back into social groups. And that might be confidence building, it might be grief counselling. You know, they might just need somebody to go along with them to events just to sort of build up their confidence slowly. But this support really does have to be personalised and depend on the individual's loneliness trajectory, because each trajectory into loneliness is very different. And then to summarise, I think, as I said, the evidence suggests that there's not a one size fits all. We need to be tailored and personalised approaches, and we definitely need a more effective evidence base on what works. A few years ago, I think it was about 2017, 2018, there was a What Works for Wellbeing review of reviews, identified several mechanisms for reducing loneliness, and that was tailoring interventions to the needs of the people of whom they've been designed. Personally, I think we should get lonely people designing interventions with us rather than us doing it for them. Develop approaches to avoid the stigma and reinforce isolation. And develop approaches that are about developing meaningful relationships. It's not just about putting people in contact with each other. It's about them making that meaningful connection. And as I said, the things about other people needing different levels of support. I think we all need to be aware, as I said, of those transition points and what we can do to support people. Talk more about our own experiences. And to share the positives. So if we've recovered from loneliness, share some of that, of how we've done that, and identify interventions early. So more of a preventative approach, I think. At the moment, we try to tackle loneliness when people have fallen off the cliff. I think we need to prevent them from getting on the cliff in the first place. And I think we need to challenge that it's an individual problem. As we've seen, it's related to structural inequalities. And the circumstances that operate at that sort of micro, meso and macro levels. I think we need to push politicians a little bit more on that one to address some of those sorts of issues. And I think, you know, maybe we should all make a pledge to address loneliness in our own communities. On the slide, there is a pocket guide to deal with loneliness. If anyone's interested, we still have copies of that. It was booklet that we produced with the Elder People's Commissioner's Office and the Age and Well in Wales team. It's bilingual, and there's some hints and tips in that from people who had been lonely and who recovered. So if anybody needs a copy of that, please just drop me an email. And I'm contactable on Twitter and Blue Sky. And if you're interested, there's a TED talk I did a few years ago on A Life Less Lonely, where I talk more about some of the people I interviewed during my PhD. And I think that's about me done.
That's great, thanks, Deb. And I came to your talk in the CADA conference, which is when it first impacted me, that, you know, how significant loneliness is and how widespread it is. And I think there's a point where somebody said that everybody at some point in their lives will experience some level of loneliness. And I think you ended, didn't you, with asking everybody in the room to make that one pledge. What can you do to help people suffering? What is the one thing that you could do? You know, even if it was saying hello to people as in passing. And I think that's something maybe everybody here today, you know, could do and spread the word, isn't it? You know, if we can all do that one thing to just take on board to be more socially interactive with people. I think that would go a long way.
I think it would.
Yeah, there's a lot of comments in the chat, and before I open it for questions, I just, with my rural hat on, I was just wondering, I know about the social isolation element for loneliness in rural areas, logistically, of course, but as you say, it doesn't necessarily equate to loneliness. Do you have any figures on loneliness in rural versus urban areas?
Not off the top of my head, I don't. It was interesting because when we were doing we did the CFAS Wales study, so it was Cognitive Function and Ageing Study Wales. We interviewed 3,500 people across Wales, older people. They were aged 65 to 102. And what we found there was, while we were expecting it to be higher prevalence of loneliness in the rural communities, it wasn't always the case. And I think part of that reason was people's expectations, particularly around loneliness, was if you're in a very remote rural community, you don't expect to see as many people. Whereas if you're in a very urban environment and you've got people walking past your door, it can amplify those feelings of loneliness. So it was an interesting one, that something we weren't quite expecting.
Yeah, and there's nothing more lonely than being on that the train trip into London, isn't it, for the commuters, and nobody has eye contact and everybody's so focused.
Yeah.
There's a few questions here. Sandra's asked, you mentioned social phobia, social anxiety disorder. Did you note it as a precursor to loneliness?
I think that nobody's really looked at it as a precursor. I think some of these things could be, like you say, precursor antecedents of loneliness, which then amplify our risk. But then sometimes it can be the other way around, that loneliness makes people socially anxious. So I think it's sort of bi-directional, really. It works both ways.
Right. And Tom, you've got your hand up. Do you want to unmute?
I live in a rural village, and the main social contact for many of the older people in the village is the bus ride into town, which is 2 miles away, as it were. Prior to COVID, there were a lot of social mixing opportunities for older people. At least 2/3 of them have now disappeared.
Yeah.
But what has come instead has been a substantial number of WhatsApp groups, and they have done a great deal for raising contact. I'm going on the 10 o'clock bus, what about you, type of thing.
Yeah.
But of course, there are still about 1/3 of the people who are not on the WhatsApp group. And I know of very few examples in my part of the world where the powers that be, the county council, the health authority or whatever, are doing anything to help older people get onto WhatsApp groups. Do you know of examples where that type of thing is happening?
Yeah, I know Digital Communities for Wales, they were doing lots of work to help people get online, so they could learn how to use technology to be able to join, and even borrowing. So some of the local authorities will loan out devices for people who perhaps don't have their own, to help them get online, and then offer training to enable them to use them. So there are schemes out there. I don't know quite how well they're promoted. But yeah, there are schemes out there. I think sometimes one of my bugbears is there's this, you see people talking about, there's this shift to online and everyone just needs to get online. But then we talk about it with younger people, how social media can be quite damaging in terms of loneliness, but we advocate it for older people as a replacement for that in-person contact. I take your point that actually it's helping people meet because they've been able to say, well, I'm going to be on the 10 o'clock bus. So there's less risk of missing people. But I think we've just got to be careful as well with technology, that we don't use it too much and replace that human contact, because it's about those meaningful connections.
Well, I can say in our village that WhatsApp has been a lifesaver for a number of people, etc. And certainly I would take issue with being concerned. Things like sort of WhatsApp, which are closed groups, should be encouraged very strongly for people to join.
I can see Deborah's point, though, because I know I'm concerned. My daughter and all their friends very rarely meet in person. It's all online, isn't it? During COVID, when they were isolated in their rooms, I know it's led to a lot of lack of confidence, lack of social skills, and not wanting to answer phones, not wanting to speak to people, which is a bit of a plague across the younger people at present, isn't it? Not so much the older generation, Tom, which I think have quite advanced social skills.
Yeah.
I just think it's a generational thing.
Yeah.
Sorry, Gabrielle's got a hand up as well.
I'd like to thank you for a really excellent presentation. You covered such a lot of ground in such a thorough way that it's left me thinking that you've covered so much at an individual level, and also you've brought in the wider socio-economic, geographical factors and so on. You've obviously spent a long time knowing this subject area in tremendous depth, and you know, I really do commend everything that you said. I found it, yes, I found it incredibly interesting. So thank you too for clarifying the concepts and the relationship between the concepts. I was going to make a similar point about communicative technology and the role that can play. Talking from quite a personal experience at the moment, I've just lost a friend of 55 years. And the quality of that relationship was such that I'm already feeling a gap, a loss, because it wasn't so much that she was my only friend, but the quality of that relationship and the fact that that's no longer there has left a hole in my life, which I know will fill over time. But this whole notion about you can have lots of friends, but some friends are very special because they provide a quality which perhaps other friends don't provide, and they provide something for you in your life. But she was elderly, and increasingly with failing faculties, she was not able to use the telephone very effectively. But she was, I suppose, a traditionalist, as she would not embrace new technology. And so it required the intermediary of her daughter to facilitate conversation between the two of us. And it required the good services and reliability of Transport for Wales trains for me to be able to visit her. And so I was going to make a similar point that Tom has made, that you know, technology does have a role to play in supporting relationships, particularly as you get older. But the downside is that some elderly people either won't or don't have the patience to engage in that dimension. So thank you anyway. Thank you very much.
Well, thank you. I'm sorry to hear about your friend. It's a difficult one, isn't it? Because, like you said, there is a role for technology, but I think my concern comes from, you hear about people, local authorities and things, they're withdrawing services and putting things online because it's a cheaper way of delivering services, and actually that makes people then more vulnerable to loneliness. So I think we haven't quite got that balance right yet, I think. So I suppose it's a word of caution about our over-reliance on technology.
I think as well, it's quite interesting, isn't it? Even supermarkets now moving to self-serve, and they said, didn't they, the impact that had on people who might be living alone, and their only social interaction would be going to the shop and talking to the person. And now they are, in some supermarkets, aren't they, putting in special tills, a slower till, where people can engage in that daily chat. But those little daily chats have such a big impact on people who might not talk to anybody else that whole day.
Yeah. And I've had participants tell me that they've, you know, I got in a taxi a while ago, and the taxi driver was telling me, because as soon as people tell you, they ask you what you do, and you say you research loneliness, you get everyone's loneliness stories, which is brilliant from my perspective. But the taxi driver was telling me that he picks a number of people up every week, and sometimes more than once a week, and just to take them to the shop to buy one thing, but it's because they have that conversation with him. And one of my participants, he was a very lonely and isolated man, a number of health conditions. And I tell this story on the TED talk that I did. And when I interviewed him, he kept Skype open, but nobody ever came on to talk to him. So the whole interview, he had Skype open, but he was just hoping that somebody he knew would chat to him on Skype. And as I was leaving, he took me into the front room of his house, and it was literally full of boxes, unopened boxes, and they were presents that he'd bought for family and friends. And he was ordering things online, and he was still ordering things online because the postman would come, and that was the only person he'd speak to all week. So even though nobody visited him, he was still ordering things. And when I told this story at this TED talk, I had a younger woman come up to me after and say, "Can I come and talk to you at the university?" And it turned out that she was in a similar position, that she had gifts. So I did the TED talk, say June. She still had gifts in her house for friends' children from the Christmas before, and that she hadn't seen them for months. And she said, my mum's always ordering things online. I wondered if she was lonely. So it actually instigated a conversation between her and her mum, who were displaying similar behaviours, and they were both lonely and they'd never discussed it. So I think, it's an interesting one, isn't it?
Yeah, and that goes back to the stigma, which we should totally try to obliterate, and there's no harm in reaching out. Roger, you had your hand up and it's up and down. I don't know. Did you have a question?
Sorry, it was just going back to that WhatsApp group comment from Tom, and I get both sides of it. But just as an example, on our roads during COVID, we had a WhatsApp group. It was really useful. People were very engaged with it, and at some point, somebody put something on there which was some people didn't like, and that person dropped out of the group. So the example of suddenly making, even within one street, someone isolated and lonely. So it's definitely a double-edged sword. Was my comment on that. And the other thing is, thanks, Deborah. It's really interesting and obviously very powerful and emotional. The one thing you've talked about all ages, but you've concentrated, I think, on older people. I do wonder. Like, I got two young boys, both have struggled with anxiety and stuff since COVID, not in school, loads of different things. But it's almost like that. I wonder if the increased loneliness reported in younger age, is that a new thing, do you think? Or if they'd taken it 20 years ago or 10 years ago, do you think that would have still been the same?
Yeah, I think it probably would. Whether it's more amplified now because of COVID, I think COVID was a catalyst for a lot of people to experience that sort of level of loneliness for the first time. So you'd hope people would have a better understanding of what it is. But I just think we were just focused on older people. I mean, I've got books going back 50 years. Talked about loneliness in older age, and not in younger people. And I think, although we know there's that U-shaped distribution, we did a piece of work last year with a colleague from the Open University, and we found loneliness was quite high among people in midlife as well. And which was the reason we were looking at things like dating apps, and the prevalence of loneliness in people using dating apps, unsurprisingly, was through the roof. So I think we're just identifying different groups as we go along.
No, thank you. There's just so much, isn't there? There's just so much.
I think the trend to home working as well doesn't help, because you are working in isolation, and that, I think there is a movement to return to the office at the moment. I think that's a contributory factor for middle people in working age. Angela, you've got your hand up.
Thank you. Thank you very much indeed for your presentation. It was very, very interesting. I just wanted to come in on a couple of comments. I think I just want to say I totally agree with you about the use of technology, and I do think we have to be very careful. We've done quite a few bits of research and studies over the years into young people, and of course we have to be very careful to understand that not every relationship is a good relationship. A lot of toxicity about there, and that if a relationship is purely online, and you hear young people saying, "Oh, I've got 100 friends," and so on. Actually, ultimately, at the end of the day, those relationships are not going to be able to feed the key things that you've identified in your talk that we all need to take from a relationship to make it feel worthwhile. I think that transport is a key. actually in rural Wales, having dealt with a number of people whose lives have compressed as they've got older because they've been less able to drive, and then the bus services change, routes don't become existent, and suddenly their lives simply shrink because they cannot get out and about. And it can be as simple as, I remember one elderly chap, and he had COPD, and the bus used to drop him at point A. They changed the route. It was now point B. You and I would be able to walk it probably, but with COPD, he couldn't. So suddenly, wow, that was it. He could no longer go out and meet people or do his shopping. People talk a lot about elderly people and let's adopt, this, that, and the other. I do think that one of the things we need to bear in mind are people's base personalities. If you have always led quite a singular life and you've had a small network, perhaps your family, you're on a farm in Carmarthenshire, you've got your rural group and your family, and everyone grows, moves on, your partner dies, your friends start dying off because you've got to that kind of age, you're not going to suddenly come out and become a party animal, whip on the lycra and go out to some sort of club. So I like the point that you made, and I think it's really clear that we must design stuff from the people's point of view, not our point of view, what they need. So we have to listen above all else, which brings me to my last point. I just wondered if you had any practical examples in all of your experience of projects that people have run that have shown real success, that you might be able to share with us so we can look at incorporating them in the work that we do.
Yeah, I mean, what works for Wellbeing review of reviews was a really interesting one. But they talked about technology in that one, where they said actually it could amplify loneliness and make matters worse. I think their general conclusion was, although interventions don't do any harm, they're also not doing much good at the moment either, because it goes back to that point. I think we've been designing things based on what we think would work for somebody who's lonely, rather than what the lonely person themselves might feel would be beneficial. I mean, some things do work for some people. I mean, I've had people who've told me that, sort of buddying up or, has been a work for them. So, I can't think what they're called now. So I flew back from New Zealand on the weekend, so I'm still slightly jet lagged.
Programs.
And words this morning are just not my friend this morning. So yeah, but there are those schemes. I think like the Red Cross and people like that have run them. That they work for some people, but they don't work for others.
Yeah.
And it just depends. And I've from a male perspective, I've had male participants say they won't go to certain interventions because they're too female centric. So I think that's where the men's sheds has been, I think, one of the ones that's been really had an impact. But again, since COVID, my conversations with men's sheds, they've lost up to a third of the men have never come back, because when they pivoted to online, they just never went back to the in-person event. So I think probably the men's sheds is one of because it's based on what men want to do rather than. And it's that men having that conversation in a way that's quite natural to them, standing side by side, whether that's at a bar or down a pit, or, men don't tend to talk face to face, do they? They'd rather do it side by side. So it's based on what works for men. So I think, I think that's be the one sort of standout thing.
Could you just send us that link? Because I've tried to Google the review of reviews. I've only come up with something from Northern Ireland. Was that the one you were talking about?
No, it was done in the UK. What I do, I've got a copy of it. If I send it to Anna, perhaps we can circulate it, if that's okay.
Thank you.
Yeah, that's fine. And there's a question in the chat box as well from Sandra asking, how much worse is loneliness amongst people in hospital? I'm not sure if you know the answer to that.
No, I don't. I don't know the answer to that. I suppose it depends how long people have been in hospital, doesn't it? And if you've been in for a very long time, it can be a very lonely place. I know, as my daughter, when she was younger, she's 35 now, she spent many months in hospital, and we have with her various health conditions, and having other family members around who were in similar positions, other families, was really beneficial. But I don't really know what the stats are on loneliness in hospitals.
Okay. Any further questions? No. Well, thank you ever so much, Deb. It's been brilliant, really interesting. And like I say, if everybody could just take from that one action, maybe we could all do to try to address loneliness in our own social circles or the circles that we mix every day, that would be a really positive outcome from today. Brilliant, thanks.
Yeah.
And we'll circulate your, we'll circulate your presentation if that's okay. Yeah, great. So finally, I'm just going to share the Mentimeter again to those who were here early. Can you see this? So if you do menti.com and then put in this number into either your phone or your computer, open another window, obviously, 3286 5469. There we are, flying in. So if you can just then rate this in terms of how interesting and how relevant the topic was, and then the impact that the talk that Deb gave today will have on us moving forward. That would be great. Thank you.
It's like reality TV.
Yes, right in front of your eyes.
Need some music in the background.
We could do, couldn't we? I won't sing to you, don't worry. Yeah, so it's menti.com, MENTI. I think it's here, menti.com. And then you put this code in, and then you can do your ratings. You just do a slide. It's a slider. I'll give you a couple more seconds, and then I'm going to use you all as a guinea pig and see if this next slide works, because I'm going to try an interactive word cloud. Okay, they seem quite static now. So the next slide, has this come up on your phones? Like I said, this is an experiment. So yes, I can see some notes. Are there any particular topics or areas of interest that you'd like to see covered in one of our future webinars? And can you type your answer in? And I have no idea if it will appear because we didn't have chance to try this live beforehand. So if you want to put any suggestions in, that would be great. Anybody? Oh, one response, brilliant. It's working. 2 for transport. I have to bring Charles back then from Aberystwyth Uni, who frailty, bone health, excellent. Any more suggestions? Pharmacies. Well, that's interesting because we've got one of our members of staff working on a review of pharmacies across Mid Wales at the moment. So Mary, that might be one for you in the future. Excellent. You can carry on inputting that. I'll pull it down for now. Okay. Just want to say thank you very much to everybody for attending today. We'll send copies of presentations to you, and some people have asked for different background reading and information, like the references that Michelle referred to and the analysis that Deb referred to. If you want to keep chatting in the chat box, feel free, and just wish you all a pleasant rest of the day. Diolch yn fawr I bawb. Thank you. Diolch.
Diolch.
Thanks.
Diolch.
Thank you.